Okay, so the nationwide shortage of GPs is at breaking point. In Lower Hutt, a clinic with 9,000 patients yesterday announced it has had to stop doing face-to-face consultations. In April, the Papamoa Pines Medical Centre shut completely. It had 6,000 patients, and it's not going to get much better. The GP shortage is global, which means, well, we can't bring doctors in from overseas, can we? And our ageing workforce means in 10 years, things will be worse. But what if the solution lay in the old saying that prevention is better than the cure? Grant and Louise Schofield have worked in public health for decades. When they worked out we spend less than 1% of the health budget preventing disease and 99% of it treating it, they had a light bulb moment. They started Precure, a bold new initiative that trains health professionals to work with patients alongside doctors. Lightens the load, you see. And they join me now. Guys, nice to see you. Welcome.
Morning.
Morena.
Yeah, so how does this work, Grant? I'll start with you.
Well, I think, like you're right, you take a step back and you're going, well, what's going on here? We've got clinics now opening with no doctors, and you've heard of one in Palmerston North, but they're happening actually all over the country. So it's just going to happen more and more. So I think the frightening statistic for this is in 10 years you can expect half of our general practice and general practice nurse workforce to be gone.
It's pretty scary, isn't it?
Yeah, they've either moved to Aussie,
Yep.
they've retired, or the workload's got too much and they're burnt out. So
It's probably all of the above, isn't it? Yeah. So what's the answer? What do we do?
Duncan, we've got to put health back into our hands. No one cares more about your health than you do. Not your GP, maybe your mum does, but the power of health. The power of health is in our hands. We need to take control. It's the things we do every day, what we choose to eat, if we move or not, what we're doing. We can control how we're going to live the last 15 years of our lives.
And this is not brain surgery, and it's not that radical. It's actually what we've been told for years and years and years, isn't it?
Absolutely.
Yeah, you've got to invest in it though, and so that's the basic reality. You get what you pay for, and we've paid for a sickness system, and that's good. Like, we want that, right? You break your leg, you get cancer, you want treatment, and we've got world-class treatment across most of that.
But GPs are crucial, aren't they? Because that's the bit that stops us going to the next level of the hospital and the serious wait times and all that sort of stuff that clogs hospitals. So yours would be even before that GP level. Yours is saying, well, you're not going to get sick. You're going to prevent yourself getting sick.
Well, that's utopia, prevention.
Yeah.
Let's be honest. Right at the moment, we're in crisis. Professionally well-trained health coaches can help the GP work at the top of their scope. They can come in. People are going to the GP because they've got chronic disease. The GP can't talk to them for 45 minutes and coach them about nutrition and exercise and what they can do for their stress. A well-trained health coach can. Let the GPs work at the top of their scope. Bring these other health professionals who can change lifestyle.
So empower them. And what's a health professional? No, just take out the word GP. So you've got GPs, but what's a health professional? Grant,
So, well, there's everyone in the primary care sector. That's psychologists, that's nurses, that's physios. They've all got a role.
Yep.
But let's face it, there's not just a workforce shortage in GPs, the actual doctors. It's every single one of these professions.
Right across. How many workers do you think we're short in the health sector? What's the number you guys think?
I think between 5,000 and 10,000 just in the nursing and doctors part, and then you go wider than that, it's actually hard to say, but they say we're probably 3,000 psychologists short of what we need.
I saw that too. Yeah. I saw that. So with that, how did it get to this point? Is it we haven't funded a population increase? Because this has slowly got worse and worse and worse. How did it get to this point?
I think we have relied too much on the system about expertising health and compartmentalising it, and we're not empowering our kaiawhina workforce, our community workforce, who can make the change. It's all specialists and waiting lists for appointments.
And see, the thing about waiting lists is the truth is that people on those lists, a lot of these people will never get to that service, will never get to that operation or that level of healthcare, will they? No. Their name's on there, but they keep dropping off.
Yeah, I think at the moment the wait list in hospital for surgical procedures is 78,000 people. So, I mean, it's an astonishing
That's Eden Park twice full. Yeah. Oh, that's a big queue. That's a big queue. So how just paint me a picture of how it looks then, of how your stuff. Give me 10 years time how it works.
So you've got a bunch of community social workers and other people in the community that have for one reason or another, often made progress with their own health. They've gone, hey, you know what, if I change these things, turn out better, I've reversed my diabetes, I've lost weight, got in shape, don't have to have my knee operation anymore. There's people. They're the people who are keen to move into health. They don't need training for a long time, but they do need training. So in 4 to 6 months, you've got someone up to speed, ready to help out. They're not operating by themselves, so Duncan. They're in a practice team.
Yeah, right. So they take the load off the GP. So they basically they're pre-screening. They're pre-screening and they're pre-working for the GP.
Pre and post, yeah.
Absolutely. So one example is our Pacifica workforce, who we have trained up, the community workers in partnership with Pacifica Medical Association. So now there's well-trained mental health coaches and health coaches going to the Pacific community, working in the churches, getting the prevention, making the difference, because a lot of our Pacifica people aren't going to the GP.
Yeah. And then it's too late, it's diabetes, isn't it? Yeah?
Absolutely.
Yeah. So what do you need? You need funding? What is it you require?
I think the normal medical crusty old guys that are going, just give us more of the same and we'll do better. I think that was Einstein that said the definition of stupidity is doing the same thing, expecting the same outcome, and there's 1,000 of those memes.
And so that's what GPs are saying now. They want more money because they can get more people and they can see more people.
Yeah, and if you want to practice medicine that is a burnout medicine, rather than actually, I don't know a single GP or practice nurse, or actually anyone in health who came into health just to be overloaded by sick people and be the ambulance at the bottom of the clip. It's such an old meme, right?
Yeah, it is. And you go to a health centre now. So where was I recently with my son? At White Cross, one of those places. Yep. And I saw the nurse first, and she did all the screening. She gave me antibiotics and sent me on my way. I never saw a doctor.
Yeah. Good.
So that's sort of happening at that level anyway, isn't it?
Absolutely. And what do we need? We need passionate, committed people who understand that your health span can equal your lifespan. If that's you, come and train. Come and upskill.
Do you have Shane Reddy's number? He's a health
text it.
He's the health minister. I'll just see what we've got here. But have you been in touch with him about this?
I think we've been starting with Matt Ducey and mental health, because that's the other completely non-existent workforce, right?
Yeah.
So there's at least in general practice, we have a structure, a workforce that's declining. It's going to be in a shambles. It is in crisis. So mental health doesn't even exist, right?
No. So with this, and final question here, with this crisis, what's the very worst case scenario? If your stuff doesn't take off, and we continue down this path, paint me a picture of this very worst case scenario. What are we going to see?
So you're going to be in a situation where you're urgently sick. Your only option is to go to the ED. The ED has a 24-hour wait time. And that's
now.
Yeah.
That's close to now.
Yeah, that's close to now. So that's just going to accelerate, presumably. And there's literally going to be no care. Unless you're bleeding out, you're at the back of the queue. And so there's no solution. And then the problem with that, Duncan, is that most of our disease is preventable in the first place. And the health system, because it's been taken over by procedures and pharmaceutical companies, is driven in a way not to think about that. And that'll get worse.
See, money doesn't seem to be the answer here, because the more money we put into things, the worse it gets. This government, despite all the criticism of Labor, spent $5 billion more in this last budget than Labor spent in their last one. And the majority of that went into health. I track all this stuff. Yeah. So if money's the answer, there's no solution. So we have to restructure things.
Yeah. We do. And at Precure, we started in 2018 and we said we're not waiting on the government. We're not waiting on academia. We are a high-impact social business with purpose, and we're going to make a difference. And hopefully, sure, the government will come on board, but we're not waiting for that, Duncan. Yeah. We're getting on and doing it now.
We will die waiting for these guys. Grant and Louise, I appreciate your time on the program. All the very best. Take care.
Garner.